Welcome back. All this week, we've been taking a look at the last 100 days of COVID-19 in the country. And tonight, my explainer, we want to take a look at some projections and models that have been done by Professor Simon Karanja. We'll be speaking to him in just a moment. He is the Dean of the School of Public Health at the Jomo Kenyatta University of Agriculture and Technology. He and his team have been studying this disease from the moment it landed in the country. And here are some of their projections and some of their findings. Now, of course, they have taken a look at the success and the efficiency of the interventions that were put in place from day one. And by now, you know, many of these interventions that are called non-pharmaceutical interventions, because as you know, COVID-19 has no cure and the treatment is still being debated. So all of these, as you know, your washing hands, the social distancing, the restricting of movement between counties, the curfew, the closure of airports and working from home, and closure of schools and other institutions. They've taken a look at those interventions and how efficient they have been in containing the spread of the virus. Now, those interventions, or those non-pharmaceutical interventions, as they have put them, would have helped prevent this country avert more deaths. So they say without the interventions, Kenya would have had over 2,500 deaths as of the 21st of June. Remember, right now, today we recorded 132 deaths. So they're saying the interventions that have been put in place by government have gone a long way in reducing the death rate. It would have been as high as 2,500. Now, today, it is at 132. Here is another one regarding those interventions. You know, we keep talking about flattening the curve. And remember, what we're saying is with this curve, we want to prolong the number of infections and have them slowing down over a long period of time so that you don't have too many happening at a go that would require hospitalization and thereby overwhelm the hospital system. So they have come up with this figure as that peak. 6,250. Now, let me explain this figure for a moment. This is not the total number of infections in the country. This 6,250 represents the maximum number of active cases that require hospitalization in the country. Now, remember, right now in the country, we have over 80%, or close to 80%, I should say, that require hospitalization that are asymptomatic. So this is the number that we don't want to reach. We don't want to have 6,250 people in the country today that require hospitalization. Right now, out of the more than 5,000 cases, 80% are asymptomatic and not requiring hospital admission, which is why we're now focusing on home-based care. So let's talk a little bit more about these numbers now with my guest, and he is the man behind those projections. This is Professor Simon Karanja, ladies and gentlemen. He is a medical epidemiologist, and he is a dean at the School of Public Health at the Jomo Kenyatta University of Agriculture and Technology. Professor, good evening, and thank you for speaking with us.
Good evening, Yvonne. Thank you for inviting me to discuss a few things.
Great. We will get into the modeling and why you do it. But first, I just want us to expound a little bit more on that figure that I've just talked about, which is the 6,250 that we're saying is the maximum number that our health system can accommodate. Now, considering 80% of the cases in this country are asymptomatic and don't need it, what would be the total number of infections that we would need that would then send us into a crisis with our hospitals?
Thank you, Yvonne. I hear your question. It is important to realize that when we talk about the total number of cases that would lead to overwhelming the healthcare facilities or our healthcare system, it is important to ask ourselves, what is this that is the threshold? And the threshold for us is computed by thinking about the total number of cases that would require critical care services. Because remember one thing, that if you do not accommodate persons that require critical care, and these are people who would require to go to ICU, and these are the severe and critically ill patients, then that will overwhelm your system. So what our computation is about is this, that if you have 6,250 active COVID-19 cases, then these cases will mean that we already have computed that approximately 5% of these cases end up with mortalities. Now, if you look back, most of the mortalities that occur or the deaths that occur will have required at one point in time critical care services. Now, if you take 5% of 6,250, it would give you about 250 cases requiring critical care services. Now, that in itself, it would imply then that if at one time you require to have 250 patients in the ICUs, then you would ask yourself the next question: what is our capacity currently? Now, our capacity currently is like this, that nationally we have 537 ICU beds. Out of these 537 ICU beds, we have 267 ventilators. Now, if you know that we also have other diseases and we have other concerns, we have malaria, we have HIV, we have people who require critical care services because of road traffic accidents, we have people who go for brain surgeries. Therefore, if you take 250 patients and that are produced from the 6,250 COVID-19 patients that would require critical care, those numbers in themselves would overwhelm us. And therefore, you would already saturate our ICU requirements.
Okay, that is important to understand. So you have been doing and working on projections right from the very beginning. So we've talked about how effective those interventions have been and how they have managed to so far help us in containing the spread of COVID-19 in the country. Professor, what then happens over the next 100 days? And more specifically, what happens between now and the 6th of July when these restrictions that were put in place by the president then expire? What sort of considerations should they be making, will be on top of their minds as they make the next big decisions for the country?
Yvonne, it is important to realize that if you take the next days going forward, already we have restrictions that are in place that have been able to avert so many deaths at the moment. If we maintain our status quo, where we have restrictions of movement with regard to the counties of Nairobi and Mombasa, if you continue to have the curfew, if you continue to have learning institutions that are closed, then this status quo is going to ensure that we delay our peak, and even as the peak comes, the total number of cases that we are getting on a daily basis will not overwhelm our health facilities. However, any lifting of restrictions, like for example lifting a curfew, in reopening of schools, creates another dynamic with regard to contacts. And those contacts are, for example, if I take Nairobi, if you opened restrictions of movement within the Nairobi County, every day Nairobi County receives an extra 2 million or 3 million persons in a normal working day from outside Nairobi County. Now, these persons that would flock within Nairobi would pick infections from Nairobi County and then distribute them to the other counties. And therefore, the mixing patterns would completely change. And if these mixing patterns completely change, then what would spiral is out of whatever, it would be a runaway case, and we may not be able even to tell you what happens if you have a runaway case. Nonetheless, if you retained the status quo and pushed the curve further to September and October, then as the numbers are going down, then you can reopen the institutions without much of a problem. And that is what we should be urging ourselves. kindly let us be resilient within the restrictions that we have already gotten. Let us observe them keenly so that we do not overwhelm our system. To you, Yvonne.
Indeed, Professor Simon Karanja, thank you to you and your team for continuing to do the work that you do with the projections.